I'm Dr. Jasmeet Kaur Wadhwa, pediatric pulmonologist, allergist, sleep specialist. I'm heading the Center of Asthma, Allergy, TB, Chest and Child Center. We're going to talk about adenoid enlargement and tonsils in children. First of all, I would like to tell you these tonsils and adenoid are our main protective lymph node of the organs. Basically, these adenoid enlargement, don't think that they are not useful for our body. They are like a scavengers or a safeguards. If any infection comes, say any bacterial infection, they prevent this infection to go to the lung or to the brain. So they enlarge themselves, but they don't want this bacteria to flow into the body and brain. So that is why whenever any bacterial infection or cough cold is there, few children develop big tonsils and and adenoid also. First, I will talk about tonsils. What is tonsils? When we look at your mouth, we tell the child, the patient to say ah or big mouth opening. Then there are some two little tonsils are there. Mostly, sometimes they get enlarged by viral infections also. So, if the child is playing active, having no fever, then do not worry. It is basically maybe a viral tonsil enlargement. Nothing much to do, just a supportive care. If any cold is there, then accordingly we give anti-cold medication, and that is all. Problem comes when the patient is having high fever and the tonsils are highly enlarged. They are red in color. There's some fluid which is coming out, and the patient is very toxic, is not eating well, vomiting. During that time, you need to seek the doctor. I think every patient parents goes and take a proper antibiotic. But then if the recurrent tonsil enlargement, then the problem can be something different, maybe allergic also. It can be because of any chronic involvement. Most of the time patient come to with chronic tonsillar enlargement, chronic adenoid. Now what is adenoid? It is again a body which is again on the posterior part of our tongue, which is not visible otherwise. We see it on the x-ray, on the lateral side of the x-ray. Again, this enlargement is not a problem till the time the patient is happy, child going. But sometime because of this adenoid involvement, they keep their mouth open all the time. They have a dry mouth, they have a reflux symptoms, they have a pain abdomen, they are snoring in the night, then they are most of the time allergic rhinitis, means बार बार ऐसे करते जाते हैं, मुंह खोलते हैं, खर्राटे की कभी कभी आवाज आती है, बच्चे ठीक से सोते नहीं हैं. तो ये एडिनॉइड एनलार्जमेंट की तरफ जाता है. उस समय पे डोंट रश टू द डॉक्टर एंड गेट कि भाई मैंने तो एडिनॉइड रिमूव कर दो, which is not a solution. If it is an allergic adenoid involvement or enlargement, we have to look at the what type of allergy the child is having, and if we cure the allergy, the adenoid also starts shrinking, and then the patient becomes better. So there are other treatments like nasal sprays, anti-allergics, doing an allergy testing, and this way you come to know, yes, this adenoid can be shrunk by this thing, and then the patient becomes better. Mostly adenoid enlargement is between 2 to 6 years. Sometime below 2 years, then we need some endoscopy to check it. Or if it is above 6 years, then also you need an endoscopy. But 2 to 6 years is normal. But if your child is having repeated cough, cold, going to the doctor more often, adenoid enlargement, and all these symptoms which I've talked about, then seek the specialist opinion. With the medical treatment also, we can treat this adenoid and sinus, the tonsillar enlargement.